I'm Teoh, obstetrician, gynecologist and fertility specialist in Perth. It has been a while since I made my last video. I've been busy looking after my patients and also finalizing my book. Today I'm going to talk about cesarean section, or more like how to reduce the chance of having a cesarean section unnecessarily. I believe women should be offered women-centered care, i.e. women should be encouraged to make the decision on the best way to deliver their babies. For me, if you ask me, the default is to aim for a natural vaginal birth safely. However, I will fully support women who wish to have a cesarean section, which is okay by itself. Nevertheless, I'm a bit worried that some women who actually want a natural vaginal birth are talked into having a cesarean section inappropriately. A cesarean section is a quicker and easier way for the obstetric team to deliver a baby. For sure, there are some valid reasons that a cesarean section is a safer way to deliver a baby, but there are many instances that we can aim for a safe vaginal delivery. The only way to know for sure whether the baby can fit in is by going through labor, and women are allowed enough time to see whether vaginal delivery can be achieved. A good obstetrician and midwifery team should continually monitor the labor progress and only advise an emergency cesarean section when it is needed. I'm going to share a few screens with you showing a few important points. Hey guys, I'm continuing on with my talk by using the shared screen. The guidelines I'm using is from NICE. NICE is from the UK, which usually offers guidelines for doctors and patients based on the latest scientific research and evidence. I've made a few points which I'm going to show you. Let's scroll down the screen. Let's see. The first one I'm going to talk about is how do we predict that this labor is not going to be successful, it's going to be ending up with an emergency cesarean section. Now if you look at this point, it says shoe size, maternal height and estimations of fetal size, even by ultrasound scan. So when you scan, you thought, look how big this baby is. Now all those things, they do not accurately predict cephalopelvic disproportion, i.e. no matter what you do, you can't accurately predict whether baby can fit in and a vaginal birth can happen. As I mentioned, the only way to be 100% sure is by going through labor, given enough time, as long as safe for mother and baby, then there's a good chance that vaginal delivery can happen. The only reserve I have is unless there's uncontrolled diabetes in pregnancy, when the blood sugar is very high very often, and the baby is off the chart. When those two things combine together, then you might predict to say, look, it may not be very safe to deliver a big baby. But otherwise, in most cases, the only way to know for sure is to go through labor. A few other points. Let's scroll down again. 1.323. Now this is the one I'm going to show you. We shouldn't be rushing into sometimes within a few hours trying to determine that it's late at night and this labor is not going too quickly, I need to do an emergency cesarean section. Yes, it's important we have to make sure that mother is fine, the baby is fine. But I mentioned that usually we can even check every 3 to 4 hourly. For first-time moms, sometimes they only dilate 2 centimeters every 4 hours, so it can be a steady progress. And we shouldn't rush into a cesarean section as long as it is safe for mom and baby, and not too much over the 4-hour action line. But we should trust the obstetric and midwifery team and involve the patients in making the decision. Let's move on to the other point I would like to show. Yeah, this is an interesting one. People often ask me, or women often ask me, does epidural analgesia, epidural, does it increase the chance of having a cesarean section? So you see those points, they think, look, based on research, it hasn't shown to have any important effect, whether an emergency cesarean section are more sections are more likely to happen. So having epidural does not increase the chance of having a cesarean section. It does, if the block is too strong, it does affect the chance of having a assisted delivery, i.e. a forceps or vacuum. But it does, with the care by good obstetrician and midwifery team, it should not increase the chance of having cesarean section. All right, that's it for this time. Bye bye.